evening, students. How are you doing? I think you are doing great. Anyhow, welcome to week 3 of lesson 2. In yesterday class, we discussed in total about the term disease, which means the state of abnormal functioning of our body organ due to microbes, but not all diseases are caused by microbes. Those microbes or a variety of pathogens are bacteria, virus, protozoans, and worms. But in yesterday class, specifically, the type of pathogen is worm, and one of a parasitic worm known as tapeworm we discussed one by one, their transmission, symptom, and prevention methods. It transmitted through eating under raw cooked meat, uncooked or under raw meat, and its symptom is which leads to loss of weight, and we can prevent by having surgical methods if the cyst is already made, and also by using anti-worm drug we can prevent by those mechanisms. But in this lesson today we are going to discuss about another type of disease, which is a bacterial disease. One, tuberculosis and cholera. Only we are going to discuss those two types of bacterial disease in this lesson. So objective: by the end of this section, the students will be able to identify the causative agent of bacterial disease, list bacterial disease, explain the effect of tuberculosis and cholera, and finally the students mention the transmission, symptom, and the control methods of tuberculosis and cholera. Let's discuss one by one. The first one is tuberculosis. This tuberculosis is mainly caused by a bacteria. The main causative agent type of bacteria is called a Mycobacterium tuberculosis. Usually, this type of bacterial disease affects the lung, and it's named as a pulmonary tuberculosis because pulmonary artery carries deoxygenated blood from right ventricle to the lung, and from the lung again, due to the help of capillaries, the oxygenated blood is carried by pulmonary vein into left auricle. Due to this reason, it's named as a pulmonary tuberculosis. Not only affects lung, but also affect other parts of our body organ like kidney, lymph node, joints, and bone. Tuberculosis can affect anyone at any age, but people with a weakened immune system, such as people suffering from HIV/AIDS, are at increased risk of being infected with tuberculosis. This tuberculosis is mainly transmitted by a droplet infection, but it requires a prolonged exposure to someone with tuberculosis for infection to occur, because its way of transmission is more easily when a people live or work in a crowded condition, which means The main symptoms includes a low-grade fever, night sweat, muscle fatigue, weight loss, and persistent cough. However, some people do not have obvious symptoms, which means asymptomatic. Those asymptomatic people may have strong immune system. And also, sputum is one of another symptom. Sputum contains a bleed. Sputum with bleed. This is one of symptom for tuberculosis. But how we can control and prevent tuberculosis? People with active tuberculosis disease must complete a course of antibiotic treatment, for about 4 months and more, according to the immune system of the body. But if the patient stop taking their antibiotics before they are completely cured, not only may they fall ill again, but also antibiotic resistant strains of the bacteria may appear, which are more difficult for treatment. Which means, in another word, the strains of bacteria may habituate the antibiotic treatment, and finally it is difficult to be the patient is cured or free from this type of disease. So this Mycobacterium tuberculosis is life-threatening until untreated. To stop the spread of tuberculosis, the tuberculosis patient have to cover their mouth and nose during coughing and sneezing, and moving away from overcrowded living and working place as much as possible in order to avoid transmission. And also having a very effective vaccine against tuberculosis. Again, also to pasteurize the milk. If the milk is infected, pasteurize and sterilize the utensils. Those are the ways to stop the spread of tuberculosis. Dear students, let's discuss the second type of bacterial disease. The second type is cholera. Cholera is another type of bacterial disease which is caused by the causative agent known as Vibrio cholerae. This cholera mainly affects the intestinal tract of our body, but this bacteria is spread by drinking or eating a food or water contaminated by a fecal waste of an infected person, and also poor sanitation of an area. This is how they can transmit. It is a particular problem after disasters and at big celebration and festival, when many thousands of people are crowded together with a little or no sanitation. This is how cholera is transmitted or distributed through. But the main symptoms of cholera infected people are many people who pick up the Vibrio cholerae do not become ill and never know they have been infected, but they still pass the bacteria out in their face, which can infect other people. The other experience mild or moderate to severe diarrhea, vomiting, and dehydration, but generally no fever. Those are the main symptoms of cholera infected people. If the person or the patient vomiting continuously, having a severe muscle cramp due to loss of salt intake, and the severe diarrhea or dehydration are one of the main symptoms of cholera. After the exposure, the symptoms may appear from a few hours to several days. The pure water diarrhea is so severe it can kill the vulnerable people from dehydration within hours. People can also vomit almost continuously. They suffer from severe muscle cramps from the loss of salts, dehydration, and shock as their blood pressure drops. Methods of control and prevention of cholera infected patients. The biggest problem with cholera is the severe dehydration that results from the diarrhea. So, on treating the disease, priority should be given to replace the fluid and the salts which have been lost. This is done by mouth, by encouraging the patient to drink rehydration fluid, but often by using intravenous drip to put the liquid straight back into the blood is vital. Students, I think you are with me. This is one of the last portions of the lesson. So antibiotics are also used to treat this type of bacterial disease, cholera. They can reduce the time gap of the diarrhea and stop any more bacteria being shed in the feces. There is also a vaccine against cholera which gives a partial protection, about 50%, by lasting 12 to 4 months. The single most important preventive measure is to make sure that the worldwide everyone has a supply of a clean, uncontaminated water, and sewage disposal is effectively applicable. This is how we can control and prevent. So, avoid eating uncooked food or drinking mainly unboiled water or non-clean water is also a one of prevention of cholera. So this is all about today's lesson. Dear listener, I think you are joyful with the lesson. Let's revise today's lesson. In today's lesson, in total, we have been discussed about a bacterial disease, so-called tuberculosis and cholera, including their causative agent and health effect. Let's do the classwork. I think you are following well and apply your knowledge on questions which are listed below. The first question is, what causes tuberculosis? Question number 2, what are the symptoms of tuberculosis? Question number 3, a person having a weak immune system is infected with tuberculosis have a high risk of blank. Question number 4, name the causative agent of cholera. Question number 5, most of the time cholera and diarrhea have similar effects in the body. True or false? Go ahead. Again, I wanted to give you 3 minutes to think and do this classwork. Hurry up. Hello students, I hope you are satisfied with the class activity. Anyhow, let's do one by one. Question number 1 says, what causes tuberculosis? Which means the causative agent of tuberculosis. I think your answer as Mycobacterium tuberculosis. Question number 2, what are the symptoms of tuberculosis? Loss of weight and appetite, slight fever, sputum with bleed, night sweat, muscle fatigue, and also persistent cough are the symptoms of tuberculosis. I think your answer likes that. Question number 3, a person having a weak immune system is infected with a tuberculosis have a high risk of being fatal or death. Name the causative agent of cholera. The causative agent of cholera is Vibrio cholerae. The last question, most of the time cholera and the diarrhea have similar effects in the body. The answer is true. Why? Because in common they affect the intestinal tract of our body. Dear students, this is all about today's lesson. Thank you for your attentive listening. Until to meet the next lesson, goodbye.